Hello everyone, this is Mary Gregory with Mass Coding Solutions. Welcome to our series. We're doing a series on helpful hints for passing the CPC test, and we are focusing on the CPT book. And we have actually gone through each chapter of the CPT book, or we continue to go through, to give you some highlights, things you need to look at when you're taking the test. So today we're going to be talking about the female genitalia system. Now, we did the male. The female system, you can also find some procedures in the urinary system that may be specific to female. Or what it is a body part that a male and a female could have, say, like a urethra. A male has a urethra and a female has a urethra. So some of those procedures may be in the urinary system. For the male, it may be in the male system. For the female, sometimes it could be in the urinary system, and sometimes it could be in the female system. But today, we are concentrating on the female system. I love my CPT professional book. Now, some people buy just the standard book, but I love the professional book. It has color, it has diagrams for me, the female of the system, or that body system. So it's good, and remember to use that when you take the test, because sometimes they will ask you a question. Say, for instance, I'm looking here at my female system, and I'm trying to find, like they may say, the fundus of the uterus. Well, you might think, where is that at? That's a picture here. The fundus of the uterus at the very top of the uterus. So you can go here. You can look at the uterine tubes here. They got some, in my book with the professional, they got these, the female tubes, they have these little things on the end called the fringes. And sometimes they ask you about these, they do like a fibroplasty, a frumbectomy. Well, that's at the end of your uterine tube. And if they had a question about that, guess what? You can look here and you can almost answer that question. They tell us as instructors that a lot of the questions that people miss, the answers are right in the book. And so my goal has been to help you to know some very specific things you can look at. So let's dive into this female system. Now, so in the female system, at the very beginning, they got some CPT codes that if certain things are being done with that, you're not going to be here. They tell you to go somewhere else. So, for example, they said if you have a pelvic laparotomy, that means you open it up, you make an incision, you open it up, and you're going into the pelvic. They said, look, don't be here. Go to 49000. You have to heed that note when you take the test. And the key would be if you saw the word pelvic laparotomy. See, that would be your key. That I don't need to be here. I need to be at that 4900. So pay attention to that. They said, look, if your patient is having a paracentesis, that's taking fluid off the area, fluid out of the abdomen, fluid out of the pelvic area. They said, don't be here. Go to 49082 or 49083 or 49084. Whatever they tell you to go to. Don't be here. Go there. And you say, well, paracentesis, look for ascites. See, you'll have a diagnosis that says ascites. And they may tell you they're drawing a fluid from the peritoneal cavity of the pelvic cavity of the female. But they're telling you where you need to go. But let's get into some very specific areas that female has. And they got the vulva, the perineum, and the introitus. And underneath that, they said, look, if your patient having a vulvectomy done, they said there's four ways that can be done. You can have a simple vulvectomy, and look, they tell you the definition. So don't miss that question. A simple procedure is the removal of the skin and superficial subcutaneous tissue. All you want to do is look in that up note and say, did they just do skin and subcutaneous? If they did, I got a simple. The next one they said is a radical. What is a radical? They tell you in the book. It's the removal of the skin and deep subcutaneous tissue. See, one of them is superficial, one of them is deep. That's what you got to pay attention to. And they're going to tell you that in your scenario. Let's move on down. Under destruction, they got simple, and then they have extensive. And they say, okay, if you're doing destruction of the lesion or the vulva, simple, that may include laser surgery, electrosurgery, cryosurgery, or chemosurgery. Well, chemosurgery just simply means they're using a medication to scrape it off. Cryosurgery means they're using some type of freezing medication. It's going to freeze that lesion and they scrape it off. Then they have extensive. Extensive could be the same thing. So you're going to be looking for, in your scenarios, one of those words, simple or extensive. That is the key to passing these tests. What else we got? Then, of course, sometimes vulvectomies can be radical. If you look at 56633, that's generally done when somebody has cancer. And sometimes the vulvar cancer can be quite aggressive. Sometimes it's not, but sometimes it is. So they may want to do a radical. Notice it got complete. Then if you have unilateral inguinofemoral lymphadenectomy, they said, look, and also I thought about this, learn to understand the parent-child relationship coding. You have to understand that. So notice 56633, 56633 is a vulvectomy, radical, complete. But you and notice where your semicolon at. The semicolon is behind the word complete. The child code says with unilateral inguinofemoral lymphadenectomy. Well, a lot of times CPT uses this parent-child relationship to conserve space. And so what my code would read, if my patient had a lymphadenectomy, removal of the lymph nodes on the right, my code would read 56634. And the way it would read, it would say vulvectomy, radical, complete with unilateral inguinofemoral lymphadenectomy. Okay? So pay attention to that. Let's move on to our next page. Colposcopy. There are several different types of scopes that can be used in doing female surgery. And you want to make sure you pay attention to the type of scope being used and the body part. Because that colposcopy, if you look at 56820, that's of the vulva, okay? But you can also have the colposcopy in another area of the vagina. So always pay attention to, number one, if it is a scope, and number two, what is the body part that the scope is being used on. Let's look at destruction of lesion. Once again, 57061. Simple, 57065. Extensive. You're going to be looking for those words, simple and extensive. Very, very important that you pay attention to that. Under biopsy, once again, 57100. Simple. That was a simple biopsy or an extensive biopsy. And they said, look, extensive requires sutures. So if you want to use that code, then your scenario must say sutures, see. So watch out for that. We got, let's look at repair. Under repair, you have repair or injury to the vagina. You may have a plastic operation on the urethral sphincter. And notice you have to pay attention to approaches in the female system. Now also, if you're doing certain types of bladder repairs that also includes working with the female system, you may be back over in that urinary system. So not every code on the female system may be here. It may be okay for it to be in the urinary system. Okay? So once again, watch out for your approach. Look at 57240. They love to give you cystocele repair. Your anterior colpography is the repair of a cystocele. So if you want to do a cystocele repair, guess what? You better have a cystocele diagnosis if they want to give you that. Look at your posterior repair, 57250. That is a rectocele repair. And sometimes a patient have a rectocele and a cystocele repair combined. Therefore, you have a combination code. You want to use that. Sometimes they will have an integral seal repair with that. So you got to use these combination codes. Look at 57267. That's an add-on code. See, so that means that that code can never be the only code, nor can it be your first code. See? So if that scenario gave you that 57267 as the first code, that's the wrong answer. It can never be first. It always has to be with something. See? And so that's insertion of a mesh. So you want to see, did your physician use the terminology mesh? And it doesn't matter. He may say it was a biological mesh. It's still a mesh. See? Sometimes we get caught up in words. The key word is mesh. Not what type of mesh, but mesh. Now, the type of mesh is important to the physician, and of course maybe the patient, but when it comes to the coding, for this particular type of mesh, it doesn't matter if it's biological or another type. What else we got? We got sling operation, 57288. Your patient may have a sling operation, so you have codes there for that. Also, watch out for your combination codes where it say hysterectomy with the sling operation or with another procedure. So watch out for that because that's important. Also, when you're doing DNC, a dilatation and curettage on a patient, you can do it on a pregnant female or non-pregnant female. So pay attention to that. And like I said, we talked about endoscopies, laparoscopy. Here goes colposcopy here. See, there was a colposcopy over here, the vulval, and now we got a colposcopy code here of the vagina. See, you gotta know the area when you dealing with these colposcopies. So that's gonna be key when you take the test. They say they have a colposcopy. You have to say, okay, whereabouts? Was it the vulva? Was it the vagina? Where was this colposcopy? And you want to look at that. Look at your add-on codes once again. Your hysterectomy codes. Hysterectomies can be done, of course, open or laparoscopically. CPT does not provide a code for robotic procedures at this time. But your hysterectomy codes can be open or with a laparoscope. Also pay attention to the weight of the uterus, because some of your hysterectomy codes will be coded by the weight of the uterus. If you look at 58260, vaginal hysterectomy for uterus 250 grams or less. See? Some of them are over that. So you got to know the weight sometime of the uterus in dealing with these hysterectomies. Some of them don't require a weight. And so pay attention to that. Here's what we talked about, laparoscopic. Once again, supracervical hysterectomy. Just remember, supracervical hysterectomy is just the removal of the neck of the uterus. The body may be left, but the neck going to be removed. But also look for your combination codes. In other words, the patient had a supracervical hysterectomy, and this one here for a uterus of 250 grams or less. They also had the tubes and ovaries. It doesn't matter if they had one tube removed or both tubes of fallopian tubes. They just don't use the whole word fallopian, but that's what that means. They may remove one or they may remove two. You're still going to use 58542. Pay attention to that. Remember, when you see an S in parentheses beside the code, that means that code is singular or plural. So you want to look at that. Ovaries. Once again, ovaries. Sometimes we have had patients in the past that had a hysterectomy done, but their tubes and ovaries was left. And then later on, they may come and just have the tubes and ovaries removed. And you do have separate codes for that, and you want to look at them. Let's move into, now in the female section, you also got to deal with pregnancies. And it's very important that I remember having a question about what's included in that global time frame for pregnancy. See, when a lady get pregnant, I think they got it broke down into trimester, first trimester, second and third, and certain things are done in certain trimester. So in here, in your CPT book, under maternity care and delivery, it tells you, it says an antepartum care includes the initial and subsequent history physical examination, the recording of the weight, the blood pressure, the fetal heart tones, routine chemical urinalysis. Now that's important. Routine chemical urinalysis doesn't say anything about blood work, and monthly visits up to that 28-week gestation. Okay, they can be bi-weekly visit to the 36 weeks gestation, and then they go to weekly. So you may have a question where it will ask you what's not included in that maternal panel. If you go to your laboratory test, they have a maternal panel there for you. And so when they say chemistry, they more than likely talking about that maternal panel. So be careful with that. You want to highlight these paragraphs here because you will get tested on it. They say your postpartum care only service 59430 include office or other outpatient visits following a vaginal or C-section delivery. And postpartum care only. Sometimes what happens, they may give you a scenario where the patient was actually seen by Dr. Jones. But Dr. Jones maybe got sick, or I don't know, maybe the patient went out of town, and she delivered that baby, and another physician, OB doctor, delivered the baby and said, okay, I will see you after, I'm going to make sure I take care of your postpartum period. So that means that he's taking care of her postpartum. He never did nothing for her antepartum. He never saw her during her pre-pregnancy time before she delivered. So watch out for your postpartum. Notice they say your delivery service include admission to the hospital, the H&P, your management of an uncomplicated labor, the vaginal delivery, with or without episiotomy, and with or without forceps. So a lot of times that episiotomy, the forceps delivery, is included in that delivery code. Because let's look at some delivery codes. For example, let's look at 59400. Routine OB care including antepartum care, a vaginal delivery, with or without episiotomy and a forceps, and the postpartum care. 59400 is to be billed by the physician that did everything. He saw the patient antepartum, he delivered the baby, and he gonna see her after the delivery. See, that's what that means. If you look at 59409, that's vaginal delivery only. Sometime I've been in the hospital and they will call a code and say, we need an OB doctor to whatever stat. Well, see, what happened is sometimes maybe before the patient's own doctor can get there, another doctor may have to deliver the baby. So he want to be paid just for delivering the baby. That's what that code is for. And then once again, you got including postpartum care. Okay? So watch out for these. 59414 is delivery of the placenta, separate procedure. Be careful with that one because when you have a baby, the delivery of the placenta is included in the 59400. But there may be times when I think what could happen, I don't see this very often, but I have seen it, where they deliver the baby, everything looked good, the patient start bleeding, and they realize that there's some retained placenta. And so they may go back in just to get the placenta. Look at your 59425, antepartum care only 4 to 6 visit, 7 or more visit, that's your 59426, and then 59430, once again, is postpartum care. And you may be thinking, well, when would I see somebody having 4 to 6 visits versus 7 or more? Well, maybe somebody started out in Charlotte with their prenatal care and moved to Atlanta. See? So now when they get to Atlanta, they may just see them starting with the 7th visit and going all the way up to the time of delivery. When the lady was here in Charlotte, they just saw her at any time between 4 and 6 visits. So you want to be looking out for that. The other thing you want to look out for is your C-section delivery. Once again, 59510. They love to give you a twin where one of the twins could be vaginal and one of the twins can be C-section. And I actually have coded some of those in my own life. And so that can happen where you have a vaginal delivery and a C-section delivery. And then the other thing that you want to look out for is what they call delivery after a previous C-section. We call them VBACs in my terminology. The lady had a VBAC, meaning she had a C-section delivery at some point in time in her life, and now she's having the baby vaginal. That's all that means. And so you have to make sure that your documentation tell you somewhere in the scenario that the patient actually have had a cesarean section before, and now she's having a regular baby. So kind of just look out for that. And you got some other procedure. Your 59866 is multi-fetal pregnancy reduction. You can see that when a patient have maybe had fertility drugs and they got 5-6 babies growing in their uterus, and they may decide to take some of those babies away, and it's called a fetal reduction. Remove 59871 is removal of a circular suture under anesthesia other than local. So if you want to use the 59871, your anesthesia must be general. It may be a MAC, monitor anesthesia care. It could be spinal, but it cannot be local. Because sometimes what I've seen is the circulage is put in place when someone have an incompetent cervix, a lady that has repeated miscarriages. The cervix is not strong, and so when the baby began to bear down at 2, 3, 4 weeks, or 10 weeks, the cervix will spread out and open up and deliver the baby. So now they can put a suture in there. Sometimes they used to call them McDonald sutures, but now they have some different names for them. But they put that circulage in, and when they get ready to deliver the baby, they take it out. So a lot of times it can be part of the delivery. It's not a separate code for that. Your abortion codes, once again, be very, very careful with your abortion codes. 59812 is treatment or incomplete abortion in the trimester. Notice it's incomplete abortion. So what you're going to be looking for there in your scenario, some type of, they may actually use the word incomplete, or they may tell you in the scenario that the patient has some retained placenta, and that could indicate an incomplete abortion. Treatment of a missed abortion completed surgically. It's going to be important that you know if it's a first trimester or a second trimester there. And just remember, you might say, oh, I can't remember what these trimesters are. Go to your ICD-10-CM book, go to chapter 15. And at the very beginning of chapter 15, it'll tell you the first trimester, I think, is 0 to 12 weeks, 1 to 12 weeks, and then second maybe 13 to 24 or something like that. There's no need to miss that. Just go to your ICD-10 book and get it. It's right there for you. Tell you what they are. Then you have induced abortion, your therapeutic abortion by D&C. And also D&E is dilatation. Oh boy, I forgot what the E was all about. But it's not the same as a D&C. So sometimes we see more D&E's dilatation as extension or something for missed abortion, I think it is, than D&C. So sometimes doctors call it the D&E, sometimes they call it the D&C. So kind of just watch out about that. 59855 is induced abortion by one or more vaginal suppository, prostaglandin, or whatever. And never ever use that code when somebody have had an incomplete abortion, and they may give them that to help them to expel the baby. But that code is not used when they're doing it for somebody that's already in the throes of having a miscarriage, as we like to say, or incomplete abortion, and then they need to sometimes they need to give them that drug to kind of help the baby to come on out. Well, I think that's going to be it. Endocrine system, your thyroid glands. Not a whole lot going on with the thyroid. I just love it. You're usually going to biopsy that thyroid, or sometimes if they got thyroid cancer or goiter, they may excise the thyroid. What you want to look for with your thyroidectomies is partial, total. Was it unilateral? Was it bilateral? Did they do one, they got contralateral? In other words, if you look at 60210, partial thyroid lobectomy, unilateral with or without the ischemectomy, then they say, well, for contralateral subtotal. So they just go over to the other side and get it, see. So watch out for those terms. 60252 is a thyroidectomy total or subtotal for malignancy. So you're going to be looking, if you want to use that one, you're going to be looking to see if the patient have a diagnosis of cancer. So be careful with that. So hopefully this will help you to think about the test, to study for the test, to make you successful for the CPC test. Some of this, I'm sorry. You know, these guidelines are not just for the CPC test. You know that, right? These guidelines is for, I think they changed it, the COC, Certified Outpatient Coder. You want to work at a hospital as an emergency room coder or outpatient surgery coder. These rules apply to that as well. So sometimes we get caught up and say, oh, I'm taking the COC or I'm taking this other kind of test. These guidelines don't change just for a test. These are the guidelines. Whether I'm taking a CCS test and I'm having to do the outpatient part on the CCS, am I doing a COC test? See, I think when I took the CRC, which is the Certified Risk Adjustment Coder, they had some, I think they just had some medical terminology on it. But at the end of the day, CPT guidelines are for everybody. Any kind of test you're going to take, that is CPT. So whatever you're learning, you're going to be able to take it with you to another test if you need to. Well, I am going to get ready to sign off for today. Thank you all for allowing me to come into your home or your study area to help you to prepare to become a successful coder. It's all about you becoming a successful coder. Yeah, we want you to pass that test, but at the end of the day, I want you to be able to go out and get a job and know what you're doing, so that you can back up that CPC. I'm going to get ready to sign off for today. We got a couple more chapters. We got nervous system, radiology, couple more chapters to go through. And remember, I'm just hitting the highlights. I can't really get into detail sometimes. So I'm just trying to hit the highlights to show you little words that you need to pay attention to. Extensive, simple, deep, colposcopy vulva, colposcopy vagina. All that is important. Your add-on codes. Pregnancy. Study pregnancy because you're going to have a couple pregnancies to code. Well, I am getting ready to say goodbye for today, but hopefully I'll be back next time. Don't forget to follow us on LinkedIn and Facebook and Twitter. And also visit our website, www.mascodingsolutions.com. Thank you, and I look forward to talking to you in the future.